Greetings to all and welcome to my YouTube channel. I'm Dr. Omer Hafeez KALEEM. Today I'm presenting my research project, a clinical trial to determine the frequency of bracket failure of MIP, that is moisture-insensitive primer, and SCP, that is self-etching primer. Clinical trials help us to determine which material to use, as there are so many materials to choose from in the market, and the efficacy, cost effectiveness, and durability of the materials is very important to check before we use them on our patients. In this trial, frequency of clinical failure of the two primers was compared. Ethical approval was taken from both the institution, and we calculated the sample size using WHO sample size calculator. We also followed the consort guidelines to make sure that the trial is of high quality and high standard. "65 patients were enrolled and randomized to Group A and Group B as per inclusion and exclusion criteria set up. After the allocation of the groups, follow-up and analysis was done. Chi-square test was used using SPSS software with the p-value of less than 0.05 to be considered as statistically significant. A modified split bout technique has been used, as you can see in the figure. Group A and Group B had been randomly allocated, and so every patient served as his/her own control. Mean age for the patient selected was 15 to 16 years. More of the female patients participated in the trial as compared to the male patients. The duration of the trial was 6 months. Every month data was collected and analyzed. The results show generally increased frequency of bracket failure with self-etching primer. However, this was statistically significant in the first 2 months, while in the third month it was significantly more, but it was not statistically significant. So is the true for the rest of the months. So, on the whole, the self-etching primer show more frequency of bracket failure than moisture-insensitive primer. We assume that there is difference in frequency of both the primers. Various studies have given conflicting results of the clinical efficacy for both of the primers. There are very few clinical randomized controlled trials in the field. Also, the evidence available is of low to moderate quality. Chavo and Campoy have similar results to our study. Chavo's study showed statistically significant frequency of bracket failure for self-etching primer as compared to moisture-insensitive primer for the first 2 months, similar to our study results. However, in Campoy results, the results were not statistically significant, but frequency of bracket failure was more for self-etching primer. Burrow, in a critical review, established that in vitro results are unreliable as compared to in vivo results. Rees and co-worker also found that long-term follow-up studies and short-term follow-up studies have comparable results. Self-etching primer, when compared with orthophosphoric etching for the enamel surface, have shown same etch pattern. However, the self-etching primer has shallower depth than orthophosphoric acid, as you can see in the electron microscope scan. In another study, it was established that applying self-etching primer for 10 seconds rather than 3 to 5 seconds as recommended by the manufacturer is better to have improved clinical results. Moisture-insensitive primer have more efficacy in saliva contaminated before or after application as compared to the competitors. Also, even if there is some blood contamination, the survival of the bracket is good with moisture-insensitive primer. A trial also established that moisture-insensitive primer is good when they are hydrophilic rather than hydrophobic. On the whole, moisture-insensitive primer offers more reliable results during dry and moist condition, even with contamination with saliva or blood. However, time for application could be more, but time is saved when bracket failure is decreased. So, moisture insensitive primer is more favorable primer to use under dynamic oral environmental conditions. Thank you all for watching.